So you'll not be surprised to hear that women, because of the action of pregnancy, the hormones of pregnancy, the hormones of lactation, even those that are going to be bottle feeding, will still go into that hormone drive for the production of milk straight after birth. And there's a different sleep cycle that women fall into with their baby. Yep. So they fall into that deep recovery sleep, that regenerative sleep. They fall into that much more quickly. They stay in that for a little bit longer. So they benefit from better sleep for shorter periods. So they can essentially cope with that sleep deprivation. And if they're breastfeeding, the feeds at night, so the milk that's produced at night that the babies drink, is actually like a little bit of a sedative. And that again allows women to sleep that much more settled because they're babies, that much more settled. So and I was a private midwife before I set up My Expert Midwife. And what I used to suggest to partners, and remember, when you're a private midwife, you get to spend hours and hours with partners preparing, so we used to have this, we called it a workshop, and we would spend about 4 hours, a morning or an afternoon, just me and Dad to be. And we would just go through, right, what can we do in pregnancy to get prepared? Are you wanting to cook meals? No, right. Well, what about doubling up and then freezing meals and have them in the freezer? Or just order frozen food from Cook, right. What about vacuuming? Will it bother you if the place is a tick? Will it really, 2 weeks, will it bother you? No, that's fine. Will it bother her? Yes, right. Well, we'll need to get someone to come and do it. And that's someone that will come and vacuum and pick up the laundry and go. Who do you know that can do that? My sister, she'd be great. Right, well, let's get her roped in. Let's see if she minds dropping everything for 4 days in that first week and getting them into that mindset of getting all that help prepared in advance. Yep. And then the birth bit, that's the easiest bit, because you basically just say, look, it's not going to be easy. You're going to be exhausted. You just have to you just sort of suck it up and get through it if you can. But that early part where she doesn't need that much support, but you'll feel that you need to be there, that's the time to get that second birth person. So, like her friend or her mum or someone, get them in then. Yep. And you rest so that when it's time to go to hospital, you're fresh. Yep. Because you know yourself, that time at that cesarean section, you'll have been sleep deprived and stressed and anxious and thinking there's all these decisions that need to get made and I really don't know what to do for the best. And having someone there, and for those early first hours, it just makes sure that you're fresh. And you're still there, you're still in the house if she needs you, but what you're doing is you're resting, because it's a big job. 24 hours, maybe even 36. And that's a long time to be on your feet. It's an awful long time to not be eating and drinking properly, to be going without sleep. So that was something we always talked about. Who would you have? Who would she have for those early first hours? And This is all agreed in pregnancy. This isn't coming as a shock to her. If she doesn't agree with it, if she wants you, then that's very different. You make a different call. But afterwards, the visitors, it's a massive, massive thing. And I've gone in to do postnatal checks on women when they're 2 days after the baby's born, and you can't get a seat in the lounge because it's just full of visitors. Yeah, it's getting passed round, and you take mum into the kitchen and she's in floods of tears because she doesn't want anyone there. Yeah. She just wants to rest. So that's the difficult one, though, because you almost have to convince her, or certainly the midwife will be saying, you really do want to think about having no one for the first 2 weeks. Just your inner circle that will cook for you, clean for you, let you get some rest. And then the other thing I talk about is, and it's really old fashioned, but if mum's breastfeeding, I would always suggest, and this is a conversation between the three of us, I would always bring up, right, what about having shifts? So mum is up all night feeding and changing, dad in a separate room, getting a full night's sleep. Yeah. wakes up and it's a shift. So this isn't you wake up when you want. This is a 6:30, alarm goes off.
Yeah, we did that. Yeah.
Making breakfast,
yeah,
a really decent breakfast, because you can get through anything. And this is someone that's done a lot of night shifts. You can get through anything as long as you know at the time it's going to end, and you can get some rest and sleep. So then
completely agree. Fresh. Yeah, completely agree.
But it's something that as a man, you know, a lot of men would feel really uncomfortable raising that as an option, really uncomfortable. And you daren't really speak about it to your friends or her friends, because it's almost seen as, well, that's an old-fashioned thing. I don't want to be viewed as that kind of man. But the biggest cause of anxiety, especially amongst new dads, is lack of sleep. Lack of control, lack of sleep. And for women, it's because of their pain. They're not on top of their pain relief. They're not sleeping, anxiety. So if you can solve that sleep problem and that pain relief problem, you get rid of a lot of the main causes of that anxiety.